I was diagnosed about 15 years ago with severe sleep apnea. Well, you can have a CPAP, okay? Then that's a good it's a great question, and we should take a few minutes to talk about it. In the medical world, a medical doctor is the person who needs to make the official diagnosis, okay? So if you want a clear, clean diagnosis about that, they're going to say the gold standard is to have a sleep study, or you're going to go into the clinic, or sometimes some of these sleep physicians are also using some home monitoring situations, okay? So there are some availability now to do some stuff at home. And that's something that's going to be developing rapidly over the next few years, and that's going to get better and better, okay? And probably the prices are going to come down as they figure out that, well, we don't need to have 24 leads. We can do just as well with 10 leads, and we don't need to make this expensive. By leads, I mean things that they're measuring, okay? So one treatment, and I want to say this. We have, because of our small mouths, everybody in this room has airway challenges all day long. But at night, when we relax, and maybe we sleep on our back, and the tongue falls back in our mouth, then we have sleep apnea, when our tongue blocks us. Or we breathe real hard, because we're not breathing by the technique in this book, okay, the Oxygen Advantage. We are breathing too forcefully, and we're breathing so forcefully that we're sucking our soft tissues together and closing our throat, okay? So with the CPAP machine, you're putting positive pressure on there, sort of blowing those tissues away so that you can get your air in, and then you breathe out, and that's pretty easy when the machine lets go if you've got one of those cycling machines, okay? So that's a treatment to help you survive the night, help you have better oxygenation during the night, also not to go into crisis. It's good that you're wearing your CPAP machine, because if you weren't, you'd be having an oxygen deficit crisis that will cause your body to dump a bunch of adrenaline in you in order to wake you up, okay? And if you get enough adrenaline dumped in you and your heart gets pounding fast enough, you can have a heart attack and die in your sleep because you're not breathing, okay? That's the worst scenario, the worst case scenario of having severe sleep apnea, is this additive stress that's put on your heart, causes a hardening of the arteries, contributes to the heart attack, contributes to stroke, contributes to diabetes, okay? So that's why the medical profession is so keyed up and rightly so that sleep apnea is a severe problem. The other thing that I want to share, though, is that mild sleep apnea is also a problem. Early or you've got severe, moderate, and mild. Mild sleep apnea is also a problem, and also a stress on the body. It's just less severe than severe, and not as severe as moderate, okay? There's also another condition called upper airway resistance. Now, that is not sleep apnea, but that means that your airway sort of closes down a bit, and that wakes you up, so you don't have quality sleep. There's lots of folks who are trim and fit. And you look at them, you go, that person looks great, okay? They're trim, fit, they're sleeping terrible. They wake up exhausted all the time. So the book Sleep Interrupted really speaks to that, okay? So I brought a copy of Sleep Interrupted. So Sleep Interrupted's on your list, okay? That book I probably recommend to half my patients to come in to see me. I'd say you got to read this book. Because your sleep is interrupted and you're having difficulty with this airway, you're clenching and grinding your teeth in order to survive the night and open up your airway. You're putting all this destruction on your teeth because of all this nighttime trauma, and it's breaking your teeth. It's causing gum disease. It's causing you to have joint pain, headaches, all the stuff that my patients that have and suffer with, and all the things that I fix because patients break up their teeth and break up their dentistry is related to this airway problem. Okay? You have another question? Comment?